Hi, welcome to Medicoria. Please like, comment, subscribe, turn on your notifications, and share with your friends. Today we're going to be talking about the history of presenting complaint, HPC, and how to get it right. The HPC is a detailed account of the presenting complaint. It starts with the open-ended question. This is the question that you ask when you're obtaining the presenting complaint of the patient. As you listen to obtain the presenting complaint, you should already be picking up main points which are going to act as your skeleton for the history of presenting complaint, so that you don't have to make the patient repeat the whole story over again when you move to the history of presenting complaint. You should identify the system affected and explore it exhaustively. In other words, you should check for each and every symptom in that system. You ought to guide the process with closed-ended questions, balanced with open-ended questions. In other words, do not use too much of open-ended questions, since this will make the consultation very long. But again, do not overuse closed-ended questions, as this might give you a wrong diagnosis. Remember that patients tend to please the doctor by saying yes to everything that they say. So when you use closed-ended questions, you might mold the process in such a way that you end up with a diagnosis out of prejudice. As you obtain information from the patient, aim at obtaining it in a chronological order, make it as complete as possible, make it coherent, and where applicable, obtain logical information. How do we approach this step of history taking? First and foremost, it's important to keep the language simple so that you can communicate effectively with the patient and understand each other. Second, it's always important to check whether you have understood exactly what the patient is trying to communicate, for it is bad practice to draw conclusions based on assumptions or by filling the gaps left by the patient. This might involve you making the patient repeat what they just said in order to clarify. It is also important that you clarify any medical terms used by the patient. This is because patients might use these terms wrongly. For example, dizziness, diarrhea, palpitations, among other symptoms. Signposting is important in this process. Signposting involves letting the patient know which stage of history taking you have reached and letting them know why you are making them repeat and things of the sort. This is important because it helps both the doctor and the patient to keep track of the process of the history taking. It also makes it easier for the patient to release information to you in an organized manner. You also need to pay attention to the non-verbal communication of the patient. This might involve their facial expressions or the gestures that they make with their hands. Also remember that not all information given to you by the patient should be taken as the gospel truth. Sometimes patients give false information to please the doctor or to protect themselves from embarrassment. So it is important that you continue to probe the patient to ensure that you obtain accurate information. You should also respect the patient's decision to reserve some pieces of information from you. However, should the patient choose to reserve some information from you, make them understand that this might come with pitfalls in the process of making the diagnosis. How do you explore your HPC? Like I said before, make sure that you exhaust the system affected. In other words, check for the presence or absence of any symptom and document both the important negatives and the important positives in that system. As you explore, you need to judge the severity of the symptoms and their impact on the life of the patient. You also need to describe each symptom systematically. There are ways in which every symptom is described, be it fever, vomiting, diarrhea, and so forth. For example, if we take vomiting, we need to mention the volume of the vomit, the color, the smell, whether it's blood stained or not, the content, among others. We shall be going through the approach of describing each symptom systematically as we cover the different systems in the future videos. If you are a student taking the history, it is important that you preserve the patient's words as much as possible. This is because just like the patient, you might misuse some of the medical terms. But later on, when you've gained experience, you can begin to use medical terms throughout your history taking. At the end of this playlist on history taking, we are going to look at a few examples of histories to help you understand each section of history taking. Thank you so much for listening till the end. Please don't forget to like the videos and to leave comments behind. And do subscribe to the channel by clicking on the logo of Medicoria that the arrow is pointing at. See you in the next video.